A lot of overtime there. Look at all that stuff. The CDC is declaring the flu has reached epidemic levels, and it's only getting worse. 36 states are reporting serious flu cases, up from 29 states a week ago. Already, the CDC is reporting that 15 children have died, and health officials say this year's flu shot may not be very effective against the dominant strain. For more, let's bring in Dr. Frank Esper, a pediatric infectious disease specialist at University Hospital's Medical Center in Cleveland. How bad, Dr. Esper, is this epidemic?
Yeah, this epidemic is going to be probably worse than what we've seen in previous years, only because that flu vaccine, as you have said, is not as effective as we would like. The most prominent strain, we're only seeing about a third of protection given by the vaccine. That means 2/3 of the strains are not being protected very well against our vaccine. Not only that, but the strain that we're seeing that's is called the H3N2 strain, and in the past, over the last 15-20 years, when we see the H3N2 strain, we usually see a lot more severe cases and a lot more deaths. So it's something that we take very, very seriously.
All right, so the CDC reporting 15 children have died. Who will this affect more? Children and elderly? Are those the two groups?
Yeah, you know, the people who are at risk for most severe disease are those children under the age of 2, those older individuals over the age of 65, but also a lot of people who don't have a lot of other medical problems will get very, very sick. And some people who have no medical problems whatsoever can find themselves hospitalized, needing oxygen or even needing breathing assistance because the flu itself is really, really bad. Other people, though, things like people who are pregnant or people who have underlying heart problems, they're also at risk of having bad flu.
The vaccine, it's not efficacious as they thought it was going to be. Why and how did this happen?
Well, what happened is that every February we have to decide what we think is the most likely strain to circulate in the next December, January, and the following year.
Right.
And so it's unfortunately it's kind of and we have to anticipate it. And unfortunately, you know, no one has a crystal ball that tells us exactly what's going to happen. Many times in the past few years, we've actually been very, very good.
Right.
And our target is that we're looking for 70 to 90% effectiveness from our vaccine.
Is it too late
this
then?
year?
Is it too late, doctor, that knowing that this is not working the way they wanted it to, is it too late then to get out another vaccine?
It is. It takes up to 6 months in order to, from start to finish of making a vaccine. So even if we knew what was going on in August, September, October, it's way too late for us to make a new vaccine. We have to test the vaccine, we have to make sure it works, and we have to make sure it's safe. And that takes a lot of time.
In the absence of that, then, we ask this question quite often, what do you do?
Yeah, the best thing that you could do to prevent flu as well as every other virus, because there's several viruses right now that are circulating, not just flu. The best thing you can do, wash your hands. Washing your hands is the best way to prevent all infections going from one person to the next. But in addition to that, making sure that when you do start having symptoms, that if you're having high fevers, if you're having body aches, if nausea and vomiting, that you keep to yourself, that you try not to go to work, or that you try to keep your kids home from school when they have illness, so that you protect others around and you prevent the spread. And then if you are at one of those people who could get really, really sick, or you feel that you're really getting really sick, the best thing to do is to talk to your doctor, because there are antiviral medications that do help prevent this disease from getting really, really bad and preventing people from getting hospitalized. And we have tested all the strains that we have seen this year, and all of them are susceptible to the antiviral medications.
It's not an easy question to answer nowadays because of what happened in the last quarter of 2014 as we deal with Ebola. When do you go to the doctor if you think you need to go to the doctor based on what you're talking about with the flu?
Yeah, you know, when you get the worst disease from influenza is when the influenza gets into your lungs and causes pneumonia. But not only does influenza cause pneumonia, but influenza can open up the back door to a whole bunch of other germs that can get into your lung and cause really, really bad disease. The biggest problem that we see is when people have trouble breathing. And so when they are coughing a lot, they can't catch their breath, they're breathing really, really fast, or they're really struggling to breathe. That's when we're very concerned that you're getting into really, really bad problems, and that's definitely a time that you need to talk to your doctor. But also, if you're a person who is at risk of having bad disease and you're starting to come down with symptoms, it's always good to at least touch base with your family physician or your pediatrician to make them aware that you're you're coming down with something so that they know to keep an eye on you.
All right, Dr. Esper, thank you so much. More information on what the CDC is calling an epidemic when we're looking at flu this season and what you can do. Appreciate it, Dr. Esper.
They're going to be here, Richard. Thank you.
All righty. Up next, how a Chris Christie candidacy